Hi, Sydney. So this is your pelvic floor, main attachment at the back to the coccyx, and that's going to be important when we talk about some of the exercises. The front, the pubic bone, that's why it's called the pubococcygeus. Groups of muscles, there's 5 distinct muscles, 3 layers, but you don't have to think about that because your pelvic floor contracts in unison, just like your abdominal muscles. You don't separate the 4 layers. They contract as a unit, and so you don't have to go into any really detail about where you feel the contraction, but just be aware of that attachment on the coccyx, and that's what we're going to think about. So my favorite exercise that I used to do with my patients is called pelvic floor with a block, pelvic floor contraction with a block, or Kegel with a block. You can use a yoga block or a towel roll. Also works well. This is 2 hand towels wrapped together. They're high up in your upper thigh. The key is not to overthink it or overforce it. So like we said before, the pelvic floor attaches to your coccyx. So you're going to think of your coccyx as an imaginary tail. You're going to tuck that tail, and it doesn't mean tuck your pelvis. When I'm doing a Kegel, there's no pelvic movement. Right now I'm doing a Kegel, right now I'm not. So there's no pelvic movement. It's just a visualization that you think of, because you don't want to think squeeze. I never say squeeze because yes, your sphincter muscles squeeze, but you also want that whole floor to lift. So you're going to tuck that imaginary tail, feel a zip through the belly. The reason you zip through the belly is the pelvic floor and the abdominal muscles, especially your transversus abdominis, are synergistic muscles, and they're going to contract together, and both the pelvic floor will follow the belly, and you'll get a better contraction. So you tuck the tail, feel the zip, feel that you're not squeezing the block is just feeling that lift, and then you relax. I don't even have to think about it. You're just going to get that inner thigh contraction, but nothing forced. So tuck the tail, feel that zip, breathe, breathe, breathe. And if you find yourself holding your breath, you can count aloud, and then you relax. So we'll start with a count of 5. You can increase to 10, but tuck the tail, feel the zip, count slowly, 1, 2, 3, 4, 5, and feel the relaxation. Sometimes you feel the relaxation more than the contraction. And you may not be feeling anything. Your nerves are still recovering. Childbirth is so traumatic, just the swelling, the pressure. So don't be concerned if you're having symptoms or you can't feel it, because the nerves are recovering, and they will recover. One more time, tuck the tail, feel the zip, you're breathing, your shoulders are relaxed. Hold, 2, 3, 4, 5. Feel the relaxation and let it go. The next one is pelvic floor contraction with a squat. So we do a lot of squatting at the Stranding Center. So you tuck the tail, and here you might feel more gluteal contraction. That's absolutely fine. Always that zip through the belly, getting that deep TA contraction. Let the knees come down in a partial squat. You're breathing, you're breathing, you're breathing. You do a double squeeze, meaning you're already squeezing, but you're going to squeeze again as you come up to standing, and relax. So tuck the tail, feel the zip. You're contracting that pelvic floor and the belly at the same time, and then you squat down. You're holding, you're holding, you're holding. You're breathing slowly, hopefully through the nose. Little squeeze as you come up, and relax. And of course, you can always have Lila in your arms. Tuck the tail, feel the zip, come down, hold, 2, 3, 4, 5. Squeeze as you come up. You certainly can go deeper, but the key is right now is make it feel easy. Make sure you kind of feel that little lift, and you always relax at the end. And then we also need to address what we call the quick twitch fibers of the pelvic floor. Your pelvic floor is made up of slow twitch and fast twitch fibers. The fast twitch fibers come in handy when you have a cough or a sneeze. So this one, we're going to not even think about the pelvic floor. You're just going to think about that kind of inward lift of the inner thigh, the pelvic floor, and the belly. So hands on the waist, step out with either leg, and then you're going to squeeze as you come to midline, bringing the foot to midline. So step apart, nothing happens. Squeeze as you come together. And then you step apart and squeeze as you come together. You can certainly go wider. Squeeze as you come together, step out, squeeze as you come together. You can alternate if you want to, step out and squeeze, step out and squeeze, step out and squeeze. And of course you can make it a little hop if you want to. You can hop together, step out and hop, step out and hop. And the little hop, that little jump will make the pelvic floor contract even more forcefully. But don't hop if you're having any leakage or if you still feel a lot of heaviness. You might not be ready for that. You can even do, if you really want to really increase your A game, and this would be a good exercise to do before you start running, is just do a bilateral hop together, and then you step apart, squeeze and hop together, step apart and squeeze as you hop together. Certainly you can make it look more easier. I'm like an elephant right now when I hop. So you're getting a handout in the mail, and feel free to ask me questions.